Welcome to the latest in our Safe at Work System series of webinars that happen every Tuesday at 12:30 p.m. I'm here with Andrew Zimakas, Chief Product and Business Development Officer at Medcan, and Dr. Peter Nord, Chief Medical Officer at Medcan. How are you, gentlemen?
Doing very well.
Doing great, Chris.
Yeah, hope everyone is good.
So this webinar is happening the day before the Toronto moves to stage 2. So I think certainly in my little bubble, I think people's moods are lifting and we're moving into summer and we're moving into stage 2. I think things are going very well. Okay, so we're in transmission, COVID-19 and Safe at Work strategies. This is the fourth of a series of Safe at Work system webinars. The first was antibody screening in context, introduction of contact tracing, what's next after an employee infection. And you'll find all of those webinars are posted on our YouTube channel at youtube.com/medcanlivewell. This one is COVID-19 and Safe at Work strategies. We're tying together the threads explored in the previous 3 Safe at Work system webinars, along with providing new context on current updates, things like the contact tracing app from Ontario, or additional guidance about what's to come in the fall. Okay. Andrew Zimakas, where he's Chief Product and Business Development Officer at Medcan. Previously, Andrew was the CEO of Sprout Wellness Solutions, a leading global digital well-being platform. Dr. Peter Nord, previously Peter was a VP Chief Medical Officer at Unity Health Toronto. And we can allow people to read those on their own. Andrew, do you want to introduce people to Medcan's Safe at Work system?
I do. I'll provide a quick overview of the system that we designed several months ago now and have been working with a number of employers across different industries. And essentially, there's an employer component to this, which is really around guiding principles and risk mitigation, in addition to some advisory. And then also from an employee standpoint, we're really trying to obviously help employees be safe, but also productive. We're trying to enable leadership, and we're also trying to enable other parts of employees' lives and their families. Essentially, there's half a dozen sort of pillar areas related to the system. The first is a group of health and safety, occupational health and safety experts that we've pulled together who are physicians, and they're really the core of the program. They're focused on policy and procedures and working with employers on pulling that together and then updating it periodically. And then we have a number of supporting elements, including a clinical hotline to support any employee needs, a communication program to ensure that everyone's in the loop, management to all employees, a virtual health program, which is obviously very important in these times, broader education across all 3 areas that Medcan focuses on: eat, move, and think. And then finally, a number of optional services that really tie into what Medcan does more broadly. So essentially, that's the system. And the webinars that Chris just talked about, we try to focus on different aspects of the system. And this is something that we view as being a long-term proposition related to COVID-19 and beyond.
Fantastic. Peter, why don't you walk us through the next couple of slides with respect to the Safe at Work system framework and providing current updates?
Yeah, well, as you see it in front of us, we have the screening testing slide. And as we expected, the antibody testing, which we've talked about in previous webinars, as opposed to the PCR testing, which is ubiquitous right now across Canada, a little bit of a different approach to those 2 aspects of testing. And not to get into a whole lot of detail, because that detail we've gone over, and the webinars are recorded, so we can get into that. But basically, the PCR testing that we see everywhere across Canada basically says, is the virus present in that individual or is it absent? And that means that they never had the virus, or the virus, they've had it and it's out of their system at this point. The antibody testing, which is a blood sample, tells us if they have the antibodies against the COVID-19. Now, we don't know how long ago that infection may have happened, but it's got to be at least 14 days to ramp up those antibodies. And so what we don't know is how long the antibody response lasts and how vigorous that antibody response lasts, because that information would be very helpful for an employer. So this is where we want to bring this back to the workplace. If we could say a positive IgG, a positive immunological positive antibody test confers protection against COVID-19 for, say, 4 months, that would be something that's very helpful for employers. That would be extremely helpful in terms of managing workflow, who's off-site, who's on-site, self-isolation. There's implications for contact tracing if somebody does turn out to be positive, implications on the screening side as well, because they're going to be protected, so they wouldn't necessarily have to go through the screening routines that many employers are utilizing these days. So very helpful information. The problem is we don't know if that 4 months is actually right. Our current modeling with the influenza A and B would be a few months, like more than weeks, not years, probably months. And the research is going on right now to try and tell us that. Unfortunately, coming up with an average doesn't help the employer dealing with an individual employee, and that's the challenge. So we might be looking at a system in the future where there would be, at some regular intervals, there might be retesting to see if that immunoprotection is still intact over time in the same individual. That might mean a finger prick or a blood sample every 4 to 6 weeks, theoretically. So that's sort of the situation right now. Right now, the Health Canada really hasn't fully endorsed the antibody testing. So it's a bit of a theoretical at this point. At Medcan, we're watching this very, very closely, and we have a team that on a day-to-day basis is watching what's happening coming out of Health Canada and how we can respond immediately to the requests from many of our clients, both private clients and corporate clients, and incorporating that again into the Safe at Work system as well. So that's sort of where we are right now. More information to follow for sure. Super valuable test if everybody understands the context and the utility of the test.
And if I can just add to that briefly, Chris, from a practical perspective, what may be of interest to employers would be how many of their employees have been infected. Were there specific groups or clusters, for example, geographic clusters that are demonstrating antibodies? Where was the infection rate the highest? And then how can they, to Peter's earlier point, how can they use that information to better plan for say future waves of the virus, or better plan for return to the physical workplace in some cases too?
Let me just jump in here and just point out, because we are getting questions, we will come back and respond to all the questions at the end of the, once we've gone through the entire deck, we'll allow time for questions. And just to provide people with a kind of guide on how to answer or ask questions, you can press the Q&A button and then just type in your question on the screen. Okay. Shall I advance the slide?
Please. Would you like me to cover this off and have Peter respond, Chris?
Yes, please.
Okay, so we're moving to tracing. Peter mentioned tracing in relation to the previous slide. A few questions that we received on this. The first one, Peter, what role can employers play in hastening public health contact tracing efforts? Yeah, so
there's what we're seeing right now, as we expected, was almost two parallel systems. A population-wide approach to tracing, which is highly valuable, and the epidemiology teams across Canada are very, very interested in this. And in terms of if we have somebody who tests positive, from a population perspective, how do we get our arms around that? How do we literally nip that in the bud before it becomes a bigger problem? And then we have the more local responses. And that could be even a municipality, but for sure, it could be an employer. And for the most part, we're not talking about small employers, but medium-sized to large employers, very interested in the specifics of tracing as it relates to their employee population. So the motivations are generally the same between the more government, the population-wide approach to tracing as a more localized approach. The concept is the same, and even the tracing technologies could be very similar. The challenge, though, is how do we identify if we have a positive case? How do we, as an employer, rapidly assess who that person has been in contact with, specifically in the work environment? So the employer may sort of care about who they came in close contact with, prolonged contact at the grocery store, but really it's who else that's in the work space as another employee. Those are the people that we have to identify quickly and deal with very, very quickly, whether that's more testing or self-isolation. So two types of approaches, both highly valid, could use similar technologies, but probably the app needs to be, whatever kind of system is in place, needs to be very focused on the deliverable, which in this case is at the employer, whether it's on-site, off-site, deciding very quickly who that positive case may have been in contact with.
And to that point on technology, confidentiality and privacy, Peter, obviously being very important. And I know the contact tracing app that's noted in the third question has been designed with that in mind. So if we can go back to your summary answer, then it sounds as though employers can play a role in encouraging voluntary use of the app. They can support government efforts in that regard, and certain employers that have the scale maybe also considering their own contact tracing initiatives as well. Is that fair to say?
Yeah, that's entirely fair. And again, an employer has the opportunity to do both. Support the population-wide approach to contact tracing, but also be focused on their own employee population and have a way to very rapidly, and again, in a very anonymous way. Names don't matter. All it matters is that the contact tracing list is created. The people that are contacted through that tracing process should not be aware of who the person was that triggered that contact, because it's irrelevant. Just that they are now at higher risk, and they should be tested themselves, and obviously self-isolating until those test results are back, so that they then can prevent the spread further, sort of that next second or third spread that unfortunately may happen within a family or within the community. So the idea is to really, again, nip that stuff right in the bud very rapidly, get our arms around the contacts and deal with those contacts expeditiously.
Do you want to advance, Chris, to the next one? So we're going to segue to treatment. A couple of questions here, Peter. How do you handle the situation where an employee is tested positive, which perhaps some of the people that are listening right now have had a situation like that? And secondly, how soon should the employee be allowed to return to work?
Yeah, so this area hasn't really changed much pretty well since the beginning, which hard to imagine that was only a few months ago. But at this point, the treatment is really rest fluids, Tylenol. As banal as that sounds, it hasn't really changed. And for the most part, that takes care of most people's symptoms. Again, most people younger are going to have very mild symptoms. Older, frailer individuals may have worse symptoms. There are, and if you're following the media, there has been over the last number of weeks, talk about treatment, whether it's steroids, remdesivir, all sorts of different opportunities. For the most part, those treatments are being utilized only for those individuals that are in an ICU. They're very sick, and these are life-saving treatments as opposed to symptomatic treatments. So for the most part, I wouldn't be expecting in the next 6 to 12 months any new medications to come out just for somebody who tests positive with mild to moderate symptoms. For sure, efforts are going forward for those few individuals that end up being hospitalized. And again, these are life-saving treatments. So as opposed to modifying symptoms sort of treatment. So that's the context. And then in terms of being allowed to return to work, we're still sticking with that 14 days. It will take, on average, most people will have symptoms, if they're going to have symptoms, for about a week. And then we want to make sure that there's a clear period before coming back to the workplace. And that typically will take you to that 14-day period. There are some exceptions, healthcare workers that are absolutely needed, some essential workers that are absolutely need to be back on the job. And there is a testing scenario where they could be PCR tested against the nasal swab. And if they have a series of negative tests between 24 to 48 hours apart from each other, and those are a series of 2 or 3 negative tests, they can be pretty sure at that point that they really are negative and they're safe, and they won't be able to transmit the virus to anybody else.
On a practical note, in reference to the first question, I went back to the checklist that our medical advisory services team has developed around handling a situation like this. And it includes items like showing empathy, bringing HR into the loop early, getting an inventory of which coworkers have been in close contact, so almost like a mini contact tracing exercise. Alerting coworkers as quickly as possible, whether it's by video or by phone, respecting confidentiality, bringing senior leaders into the fold to check in on the employee, and then finally guiding them to appropriate public health and other resources also. So that's an example of the kind of checklist that would be built into the system around this particular item.
Yeah.
In terms of safety at the workplace, the physical workplace, or the shared physical workplace, I should say, particularly pertinent given this is being contemplated by more employers in terms of returning a larger subset of their employees back to a shared physical workplace. Wanted to talk a little bit about protocols, whether it's related to PPE or masks, for instance, which seems to be getting quite a bit of focus more recently. What are the measures that a workplace should adopt to be more safe? And then we want to talk a little bit about something called the post-promise after that. Do you want to just lead off on the first item, Peter?
Sure. Yeah, so all of our corporate clients that are participating with our system have really doubled down over especially the last number of weeks, as we've seen each province start to adopt a phased approach of returning to on-site work. Variations depending on the COVID positive case rate in a particular region, the type of work that's required, essential versus non-essential. And across Canada, there's been a bit of a variation in terms of how that's all happened, but the same basic principles underlie all the policies, all the procedures that have been adopted, and frankly, even the legal frameworks that have been adopted provincially to allow some of these things to happen. And it goes back to what I call the first principles of COVID-19, and that is we need to prevent transmission. How do we do that? Droplet based, so that's 2 meters or 6 feet. Very difficult to have any transmission outside of that sphere around your respiratory tract. Just to anybody who's any closer than that, or having a more frequent or prolonged contact, masks use, face shield use. We're seeing that increasingly in some jurisdictions. And when it comes to the physical space, unidirectional flow, how do we deal with washroom capacity? So, only half the number of stalls to be used, those sort of things. Entry points, choke points really are high risk areas. So doorways, entryways, exit doors, entry to elevators, elevators themselves, doubling down in terms of cleaning protocols on high touch areas like handrails, doorknobs, and elevator buttons being kind of the top 3 to 4. And then starting to really think about the actual workplace where the individual is spending most of their time, and minimizing the requirement for that person to be either interacting or moving around the physical space. So if there's an office building, minimizing the floor-to-floor transmission by decreasing the movement between floor to floor, eliminating the amount of steps that have to be taken between elevator and workspace. If somebody is moving, just keep moving as opposed to stopping in one, and spending 10 minutes sitting beside somebody. Meeting rooms, in many cases, meeting rooms have become higher risk areas. And so often the meeting rooms up to this point have been basically off limits, and meetings have been entirely virtual. So those are some of the sort of the hit list of items that most of our clients have adopted. And that was probably even a few weeks ago. As we've started to move, even in the Toronto environment, to more non-essential businesses opening, we'll see the patios with tables spread farther apart, servers wearing masks, frequent hand washing, frequent deep cleaning of the areas, kitchen protocols that are highly sensitized around the potential for COVID transmission. So all of those have been adopted fairly broadly because it's been essential to get back to work. And then, considering where the sector, the industry with which our corporate clients are involved, are they retail? Are they corporate? Are they in food service? Is it banking? And is that banking retail? Or is it banking office? Or is it banking trading centers? Each of those areas has its own particular risk parameter that we've been happy to work with our clients in terms of developing a customized plan based on these first principles. So that's the state of the art these days in terms of where we are, Andrew. And again, it's been great to work with our corporate clients that have just been so willing to take these measures to protect their staff, to protect their customers, and ultimately to protect their communities.
Thanks, Peter. And with that, maybe in the interest of time, I'll just direct people, if they're interested in finding out more about the post promise, which is really related to what Peter just summarized, they can go to postpromise.com. But just to preview that, it's a national movement that's assisting large and small businesses with safe and responsible operation as we continue through the pandemic, and really to restore consumer confidence in that regard. And it covers off many of the areas that Peter mentioned: maintaining physical distance, staying at home if unwell, practicing respiratory etiquette, cleaning and disinfecting regularly, and finally washing and sanitizing hands. So very fundamental areas which are critical, and it's supported by the federal government. It's supported by local governments in addition to the Retail Council of Canada and other similar groups. And it's really all about restoring confidence and really bringing the economy back as well. So it's a voluntary commitment and sort of a pledging and a badging in that regard that should help businesses. So finally, to wrap up, a quick one on looking ahead. I know that a lot of us are thinking about the possibility of future waves of the virus, particularly as borders begin to reopen and as people return to the physical workplace. Maybe we can end, Peter, with a few thoughts on considerations that employers can be taking to prepare for that.
Yeah, so two quick points on this. Number one, use the time right now before we really start to ramp things back up and getting back to business to really think strategically about the future of your business. And not just 6 months from now, but two years from now. What does the business actually look like? What's the value proposition? And frankly, how do we deal with the new workforce expectations about on-site versus on-site work? How do we move somebody between home and on-site so that there is a balance, focusing on, like never before, on employee health and wellness, and really focusing that strategy around that. Ultimately, that's going to be key to success in the future. So that's the one point. Second point in terms of thinking about the future is the more that we get right what we've done so far. So the more that we're getting testing right, the more that we're getting tracing right, the more that we're getting the cleaning protocols, the post-promise sort of activities, the more that an employer does all of that, if we start to see the beginnings of a second wave, if the numbers start to turn around, and you look at some countries around the world, there has already been a full-blown second wave. If you look at Iran, Saudi Arabia in the Middle East, they had a peak and they're already at a second wave now, which is matching the first peak. So what we don't want to have is a slow response. And everything that employers are doing right now, all the things that we've talked about in the Safe at Work system, that's basically your early warning system built. So as soon as we start to see community numbers start to go up, if we start to see some more positives affecting our employee base, we can very rapidly respond, nip that in the bud. It does mean we're going to roll back some of the more freedoms that will be built in over the next little while. And that'll happen at a public policy level, but it'll also happen at the employer level. So employers may not be given the chance or the opportunity to weigh in. They may just be told, but many employers will be highly proactive because we just need our economy to get back on its feet. We need our businesses to get back on their feet. And they realize that there might be a short-term pain for a long-term gain. So that's the second point. So first point, think strategically about the future of health and wellness and your employee base. And secondly, keep doing what you're doing today in terms of keeping a safe workplace, because that's your early warning system that if things start to go a little sideways, we can very rapidly, all of us, turn things around, be a bit more off-site versus on-site, and literally control that second wave before it ever gets out of hand, and do that as quickly as possible, and so that the second wave becomes really a non-issue.
Thanks, Peter.
Fantastic. Andrew, are we ready to transition to questions now?
Yes.
Okay, so several questions have come in through the course of the webinar. One, Peter, I think you're probably the proper person to ask this one. Are antibodies S or anti-C being tested? That's a bit of an obscure question, but do you understand what's being asked there?
Could you say that again? I couldn't quite catch what you said.
No, sure. Is anti-S or anti-C being tested?
Yeah, no, so that just goes to, there's many antibodies that are in the human body, and they all do slightly different things, and they last differently in the system. We're really only, and for example, the closest one would be IgM and IgG. And the IgM, we know for sure it comes on very quickly after symptoms, within a couple of days, but then it kind of peters out after a number of weeks. The IgG is the one that's being focused on exclusively, and it comes on at about 2 weeks after symptoms have started, and then that will continue again, we're assuming, for months. So all of the tests that are coming out right now are looking for sure IgG. Some of them are looking at IgM plus IgG. And that's really where the focus is now.
Fantastic. Okay, we'll take 2 more questions, I think. This is so this is a sign. So the person asking is there's a sign at their building, 90 seconds between bathroom breaks. I think that what that means is that people should wait 90 seconds between using, say, a bathroom stall before they go into the stall. What is the logic behind that, and does that make sense?
Yeah, I think the logic that would come from 2 things. Number one, the fact that the virus is droplet borne and droplets will be pulled onto a surface within that 2-meter range. Again, that's where we get our 2 meters from. And that doesn't happen instantaneously. It's a sort of a slower process. And I think what they're thinking about is that the 90 seconds is enough for those droplets to settle onto a surface. And then the next part of the sign should be saying, clean surfaces frequently, frequent washing hands before, after, not touching face, that sort of thing. Also, the 90 seconds allows the droplets to literally come out of the air and down onto a surface. So I'm thinking that's probably where that's coming from. The other aspect of that, we talk about physical distancing, but there's also temporal distancing, so distancing in time. And the 90 seconds also probably allows fewer people moving in around other people as well. It's sort of giving a break, not just a physical distance, but a time distance between people. That is one more way of making sure that everybody's safe.
Fantastic. Last question, are outdoor meetings, what's the recommendation on outdoor meetings for workplaces? This is something actually that I've been hearing about in my own circle, that people are, their bosses or executives are gathering teams. So it's physically in-person meetings, but outdoors.
Yeah. So for sure, the risk for transmission outdoors is less than indoors. No question. We've known that all along. And still, though, even outdoors, your risk is, although it's lower than indoors, it's not 0. And so still outdoor meetings, physical distancing. If physical distancing can't be maintained, masks should be worn, hand hygiene, again, using the hand sanitizer, frequent hand washing. All of that should still be in place. But however, if it is possible to have meetings outdoors versus indoors, much less risk on that one aspect. And so to be encouraged, if it's possible, for sure, lower risk in the outdoors. However, still, that doesn't mean just because we're outdoors that we can be congregating close together and literally exchanging droplets in a way that could make each other sick. So outdoors, fantastic if we can do it. Walking meetings, if we can do it. Still, unless you're in the same household, then maintain that 2-meter separation. And if not, then for sure, obviously frequent hand washing and mask usage.
Fantastic, thank you. Andrew, any final thoughts before we transition to the next phase of the webinar?
No, I think that's well covered, and I just want to say thank you for all the questions, both leading up to this session and during. But I think that's a good summary of what we've covered, at least at a high level, the last few weeks. So just want to say thank you to Peter, and thanks for everyone for attending as well.
It's funny that we are ending this phase of the Safe at Work System webinars just as we're moving to stage 2 in Toronto, and Medcan overall is transitioning to its summer programming. So it all feels very apropos. I'll just take people, I'm going to show you how our webinar attendees can learn more about the Safe at Work system. So this is the medcan.com site. So if you scroll down on the main page at medcan.com, you can learn about the ecosystem of services, including stay at work. There's CMO in a box and nursing support and seminars. There's stay at home, and then there's return to work. If you have any questions, or if you have questions about learning more about the Safe at Work system at all, then just press the Get in Touch page, which then leads you to a form to fill out. So that's that. Then I'll draw people. So the next webinar that we have is Flu Season Amid the Pandemic with Dr. Aisha Khatib. And Dr. Aisha Khatib is an assistant professor in the Department of Family and Community Medicine at the University of Toronto. What she's going to be talking about is, so we're heading into an interesting flu season. There are a number of questions about the flu season coming up. Are infection mitigation steps going to decrease the prevalence of flu this season, or should we be worried about the flu in terms of flu seasons can overwhelm emergency rooms and things like that in the best of times when COVID is happening concurrently? This could be pose a problem as well. So she's going to be talking about that as well. So that's great. Thanks, Andrew, and thanks, Dr. Peter Nord, for this one. And we'll see you soon as we transition to the summer programming. Thanks very much, folks.
Thanks, everyone.